Welcome, dear students, to our radiology educational channel. Today's topic is radiology of left atrial enlargement. We'll explore its anatomy, causes, pathophysiology, and the key imaging signs on chest X-ray and echocardiography. The left atrium is one of the four cardiac chambers. It lies posteriorly in the heart and receives oxygenated blood from the pulmonary veins. It has thinner walls compared to the ventricles and contains a small extension called the left atrial appendage on its anterior aspect. Its main function is to receive blood from the lungs and pass it into the left ventricle during diastole. Left atrial enlargement usually results from chronic pressure or volume overload. The most common causes include mitral stenosis, mitral regurgitation, left ventricular diastolic dysfunction, atrial fibrillation, both a cause and a result, restrictive cardiomyopathy, high flow left to right shunts such as VSD or PDA, the pathophysiology. When the left atrium is exposed to chronic pressure overload as in mitral stenosis or chronic volume overload as in mitral regurgitation, it undergoes stretching of its walls, structural remodeling, and an increased risk of arrhythmias, especially atrial fibrillation. This enlargement reflects the severity of the underlying disease and can influence overall cardiac function. Chest X-ray signs of left atrial enlargement, normal versus enlarged left atrium chest X-ray side by side. You can identify left atrial enlargement on chest X-ray using these classic signs. One is double density sign, a second contour along the right heart border created by overlap of the enlarged left atrium behind the right atrium. Two is splaying of the carina, a widened carinal angle greater than 90 degrees due to upward displacement of the left main bronchus. Three is straightening or bulging of the left heart border, caused by enlargement of the left atrial appendage. Echocardiographic signs of left atrial enlargement. Parasternal long axis echo view with measurement overlay. Echocardiography provides a direct and quantitative assessment of the left atrium. Linear anteroposterior dimension of the left atrium measured in the parasternal long axis view. Normal, up to 40 mm in adults. Increased left atrial diameter more than 40 mm in adults. Left atrial volume index Levy, normal, up to 34 milliliters per square meter. Increased left atrial volume index more than 34 milliliters per square meter. Additional findings may include abnormal transmitral flow patterns or signs of increased left atrial pressure, depending on the underlying cause. Recognizing these signs on both chest X-ray and echocardiography helps in the early diagnosis of mitral valve disease and chronic cardiac conditions. Left atrial enlargement is also an important predictor of atrial fibrillation and its complications. Stay tuned for more educational videos and don't forget to like, share, and subscribe.